Hello and welcome to Women of Wayland podcast. This is Yamini, your host, and you are listening to a podcast that brings remarkable stories of next door women from a small town in Massachusetts. Welcome back to our brand new episode with Jessin Varghese, sponsored by Chetna Bhardwaj. Last year, we were trying to find someone from the healthcare industry to showcase what a day in a life of a healthcare worker looks like during COVID-19. And that is how we found Jessin. It is my pleasure to welcome on our show Jessin Varghese. As a healthcare worker, Jessin really is a hero every day. But during COVID era, her work has mattered more than ever before. She has a bachelor's in neuroscience and then received a master's in family nurse practitioner. She currently works at UMass on the inpatient endocrinology consulting team, focusing predominantly on people with diabetes. I also want to announce that with this episode, I'm going to take a mid-summer break with podcasting work. We've talked about mental health in our previous episode. As we open up, I must confess, I'm realizing my own levels of pandemic fatigue and languishing. And since summers are so precious in New England, I think I owe it to myself to take a break and do the right thing for my mental health. And I think I have earned it. Ode to the ER at 1 year, Stephanie Gardner, MD. So she's the one who wrote this poem, and I wanted to recite it for the audience. Then came the news. The vaccine was here. Who will be the first willing to go down again into the unknown? And we were there, arms bare and ready to jump once again. Despite scoffs at vaccines, limited data, and a few frightening reports, and the roar of disease began to retreat. The tents fell today, exactly 1 year later. A new normal now teases from the horizon, tendrils of light seeping into our 1 year of darkness. Are we heroes? Villains? One thing is certain, we are brave. We put everything online and we arrived at work on time. Thank you so much for coming to our show, Jessin. I would like to tell our audience that you are a wonderful, amazing, beautiful soul who took over our Instagram last year to show us a glimpse into what was like in the hospitals at such a strange, unknown times. So thank you so much for doing this. Tell us about how did you end up in Wayland?
So about a couple of years ago, my husband and I were looking into places to buy a house. And, we're thinking about our future. We're thinking about, long-term goals and where do we want to be. We wanted to be close enough to Boston, but, I work in Worcester at the University of Massachusetts, medical center. So I wanted somewhere halfway. And and Wayland kind of had this sort of small townish feel to it from what we kind of knew about it, but it was still close to everything, close enough to all the cities. And, we also at one point were thinking about, when we have a family as well. And we heard about the good school system and this community being just a really incredible community to have children growing up in. I think Wayland is a great community to have a family. But even still, I think just the two of us being here, we've appreciated a lot of what the community has to offer. And we certainly want to explore more. We haven't had much of a chance to. Just with COVID and everything, but we intend to really get a little more involved in the community and explore what it has to offer. We're really excited about it.
Yeah, absolutely. I mean, and we're with you. We're fairly new as well in the community. It's been 5 years now. I have to still explore a lot of Wayland. In every episode, we ask our guests how they ended up in Wayland, but I've never really discussed how I ended up in Wayland. Well, you have Chetna to thank, and that is why I am so thrilled to partner with her this season with this episode. As working from home became the new normal, throughout the past year, we all looked to expand our homes, move to bigger houses, and buy one if we aren't owners yet. Well, surprise, surprise, that has resulted in a hot market in Massachusetts and across the country. How does one make the best of the hot market, by the way? Collaborating with the right agent might be the answer. Wayland resident Chetna Bhardwaj can help. Chetna specializes in helping people buy and sell their properties throughout Metro West Boston. She's passionate about real estate and listens to her clients intently. Whether you are buying or selling, Chetna will work tirelessly with you from beginning to end to make your real estate transaction as smooth as possible. She'll be there for you every step of the way with her time, skills, and undivided attention. So if you're on the market or considering being on the market, contact Chetna now. How do I know all this? Well, she's the reason why we are in Wayland. Just tell me about last year when you took over the Instagram, when you first heard about the podcast, and I connected with you on Instagram. Well, how was it? What was your first thought on doing that Instagram? I remember you showing us the insights of the hospital too, not entirely, but yeah, you showed us a day.
Yeah, what I could in case my hospital
Yeah.
what I was allowed to. Yeah, with protecting patient privacy. But yes, it was a really interesting experience, and I actually really appreciate it because I don't think the average person really knows, unless you, God forbid, have a loved one or you yourself has to be hospitalized, just sort of how many people are involved in running the hospital. When I was doing the recording in itself, I think I gained a new appreciation for that as well. Just walking around, seeing, everyone from the folks that are in environmental health that do a lot of the cleaning, and just maintaining that aspect to reduce infections, to just the cafeteria workers, to the nurses, the occupational therapists, to physical. There's just so many aspects of just how many people are involved in maintaining a hospital. So for me, I found that to be really interesting for myself, just to be able to learn and gain a new perspective on my day-to-day work experience. When I heard about your podcast as well and what you guys are doing, I thought it was great. I think it's really interesting how you highlight women in this community, because I think unfortunately, it's still really underrepresented in different fields and what they contribute. But it's great that you're recognizing it, and you're recognizing that a lot of people have stories to tell that you wouldn't necessarily expect, and kind of the backgrounds that they come from. So I was really excited to be involved in that aspect, to sort of shine some light on what it's like. I wish I was able to go into more detail about what it's like to be a woman in this environment, because I think at that point I was really just trying to highlight what happens in the hospital. But yeah, it was just a really interesting and great experience, and that's another reason why I would love to be more involved and sort of, in whatever way I can to bring some more light to that.
Thank you so much for doing that with us last year. And I was trying to find someone from the healthcare industry to talk about it, and it was so new. A lot has happened since then. Just taking you back to when all of this started. Tell us your first time encountering the panic at the hospital when you arrived at work. People were frantic. What was the situation like?
I remember we started seeing patients coming in, suspicion for it. There's just not a lot of information on how to protect yourself. Is it airborne? Is it droplet? And there's different precautions you need to take for those when you're interacting with the patient. I was so nervous. Most of us treated it as if it was an airborne disease. So you'd have to wear the N95. There's a whole process, step by step, on how to put the PPE or personal protective equipment on yourself before you go into the patient room. And then there's sort of this panic too. You think, were there patients I'd seen before that may have had it and we didn't know about it? I still experience that. There's still patients that test positive later, after you've seen them in person, and you think, I wish I wore all this protective equipment. What if I have it now? There's a lot of panic about, I know even for myself, about if I've interacted with a patient and I have asymptomatic symptoms, and then am I transferring that to my
Oh,
loved
yeah.
ones, my parents, my, people who have young kids?
Did you guys come back home or did you put up in a hotel? Like I heard some of the healthcare worker doing.
Well, in my case, because it's just me, myself, and my husband. My husband also works in medicine. So, I did come home. I made the choice. I know a lot of colleagues of mine who have young children, or people that are vulnerable, older, immunocompromised, that took a hotel and stayed at a
And
hotel
and
next
and
to the hospital.
paid with their own expense or
I
at their
think
own expense?
initially, but I think the hospital also was really good about reimbursing people as well, because they recognized, this is a big sacrifice to have
Hmm.
for you to come in. It's almost like battlegrounds, like war, war reaction. You're taking risks to put yourself in the way, in the place of harm. Um, and so a lot of people, the hospital as a system, I mean, my organization has been incredible. They are very grateful, very thankful, and did everything that they
That
possibly
good.
did to make things safer and more convenient for employees. I mean, at one point, they had grocery stores bring in supplies to the hospital because the hours would always be
Oh,
different in the public setting, right? So you could
right.
order your groceries through the hospital, and vendors would, pre-package and deliver it so you could pick it
How
up at any point
nice.
in time. Coffee was
Mm-hmm.
always free. I mean, just little things, it just sort of reassured you, and you felt like you were all
You
in
were
it
wrapped around
together,
with care.
and you
Yeah.
were, yeah, provided care. But yeah, that panic initially, just not knowing what you were coming up against, what you were at risk for. There was a period, I mean, it's all over the news, where we didn't have enough protective equipment. People panicked. There were people that stole stuff from the hospital for their own
Oh.
personal use. I mean, that's in a
Mm-hmm.
lot of hospitals. I'm not saying it was mainly in ours, but these are things you encounter where you feel, people came in. I saw people coming in with gas masks of their own, trash bags that they were wearing, because they were afraid they would just not have enough equipment.
Wow.
Thankfully, our
Wow.
organization was able to secure a lot of equipment for us to make sure we were safe. And they really limited the amount of people going in and out of positive patients' rooms to be able to, whatever we could do as televisits, if we can call into the room, or um, do video visits. They encouraged
Right.
that, especially for consulting teams. It was only really like one or two people that actually had to go into the room. So, things like that.
Do you think the responsibilities and the duties of healthcare workers were shuffled because of the incoming numbers of COVID cases? Like, for example, you specialize in diabetes, and I think you only
Mhm.
see patients with diabetes, right?
So a lot of patients that came in that had COVID, they didn't have diabetes before, but they had extremely uncontrolled blood
Ooh,
sugars that
okay.
the primary teams um, needed help managing. So people came into the
Mm-hmm.
ICU that needed insulin through the IV at really, really high doses, and it was outside of protocol that we helped develop. Okay, these were not in protocol before because we never encountered anything like this when they had COVID. Their blood sugars are so high they required much, much higher units of insulin than they ever would have
Wow.
before. Or if they don't have diabetes even. So we did interact a lot with the teams for these patients. A lot of the DCU patients also we consulted on. Many of them we had to do consults.
What is a DCO?
The DCU Field
Mm-hmm.
Center, the DCU is it's actually an event space that's in Worcester that was turned into a field hospital. Oh, just to go back to your question, I'm sorry, I didn't really
Mm.
quite answer it. To the reassigning, yes, there was a
Redeployment.
redeployment.
Okay.
So, patient, doctors, nurse practitioners, PAs, nurses who were previously working in like outpatient
Mm-hmm.
settings were
Mm-hmm.
redeployed to
Okay.
inpatient settings. So, to the bedside, or to assist the
Mm-hmm.
hospitalist teams to relieve some of the burden on them, and to help treat
Right.
these patients. So there were, you may have seen in the news as well, like there were people that were primary care that
Mm.
suddenly had to be working with infectious
Yeah.
disease. They've received some of the training in their original process, but weren't actively working in that field, but they did, like many of my colleagues as well,
Yeah, right. Okay.
had to be redeployed to
I see.
different fields than they usually worked in.
Tell me, what was your first lowest point emotionally after you were dealing with going into work and with all this PPE? I saw nurses crying because it was right embedded, like it was like dug into their faces, and they had these marks on their faces, and I saw so much of that. What was your first lowest point, like as a person, as a healthcare worker in the hospital? Or when you came back home? And
I think that's where it really hit me. I mean, I certainly felt for my colleagues in the ICU or the nurses in the floors that daily, just the emotional impact, people that I've never seen cry that were crying. That was really, eye-opening to me. But also personally, when I would talk to my parents and realize I can't see them. I can't go and give my mom a hug. That was really hard. The first few months, I think I was like adrenaline, do what I need to do, like get through it, right? To treat the patients.
No.
But then when I realized this is going longer than a month, this is gonna be our reality for a while. And now it's been a year, so several months after it started, I just I wasn't able to go and be with my parents, and I had to stand at the driveway to say hi to them, so that I think was my lowest point. And I would come home and cried with my husband, and or just have moments, again, I'm kind of an introvert, so sometimes I would just sit in my car and try to like decompress for an hour before actually going into my house, and then strip everything that I could before going inside the house. But yeah, I would say that's kind of when it hit me.
Okay, I can't even begin to imagine what would it be like, because we were all home and we were trying to work from home, and there you were in the battlefield with people and the unknown things that were happening. Yeah, absolutely, Jess. I have so much respect, and I don't stop saying it, that you are my hero. And people like you have been there since day one, and they're still dealing with this despite everything. There is a line in this poem that speaks about how you guys were first considered hero and then villains. If you want, I can read it out to you again. But did you feel that?
Oh yeah. Yeah, there was just so much support, I think, and people were, I felt that sense of like gratitude, and it was really encouraging. It was really, it meant so much to all of us. I think that helped us kind of pick ourselves up and go, because we felt like, okay, the whole country is, the world is recognizing the importance of this and is supporting us. But at some point, I can't really pinpoint exactly, maybe like 5-6 months in, when people started to realize that they can't do the things that they want to do, and became stir crazy, and they felt like people couldn't get back to their jobs. They, you couldn't go out. There were so many restrictions. And then they started feeling like, this is how I perceived it. It seemed that people felt that it was us enforcing these rules. And then there was a lot of speculation. Is COVID really real? Is it really that, because they didn't, most people don't have to deal with the day in, day out realities of it. And we did, and we kept, encouraging just that we move slow until things start getting better. But yeah, no, definitely felt there were some folks that were very much, what about the economy? What about this? And I understand, I get it from all the other perspectives of why people wanted everything to open up again. People didn't want to isolate anymore. I mean, I get it, but yeah, that was really hard. And suddenly it seemed like people were no longer thinking of us as the heroes. Again, I don't even know if I can put myself in that category, but like,
and I'm not saying it just from other people's perspective, but my own. I think that the benchmark of safety just was so different for different people. Some people were not seeing people. Some people were still seeing people socially distant, and in like you said, yeah, it's only the health workers who could see what was going around in the hospital, that morbidity,
Mhm.
the deaths and the
Oh
intubations
my
and
gosh, there was a wait list of people waiting in the emergency room to get into the ICU because they were so critical, but there was just not enough space. I mean, different parts of the hospital had to be converted
yes, yes.
into like COVID units,
Mm,
right? The field hospitals had to start coming up because there's just not enough room in the hospital, and there's not enough staff. That was huge. Staff were getting
yeah.
sick, you know. So it was just chaos. It felt like such chaos. And I'll share one story where it felt like I was just so I think that's when it hit me that people just don't get it. There was a person that was coming into the hospital. So all the most of the hospitals, you know, including ours, there's only one point of entry now, right? And when you come in through that lobby, there's a person that does a screening to make sure you don't have any symptoms of
Right.
COVID. And then they do, in some cases, they do a
Mm-hmm.
temperature check. And then they make sure you have to wear a mask when you enter to go anywhere in the hospital, including employees. We all have to do it, but especially people who are visiting too. And this one visitor, I remember walking out of the hospital lobby because I was trying to get to the next building. So the main entrance, I was walking out, and this person, I would say is a younger man, clearly there to visit someone, but he refused to put a mask on and he refused to proceed with any of the proceedings you needed to do in order to come into the hospital. And he was shouting, and they had to bring security out. And he said, I don't believe in wearing masks, and I don't need to do this. And it was just so hard. It just hit me so hard, I think, because I was like, wow, this person really has no idea that his
Could
actions
be.
impact other
Yeah.
people, and he doesn't realize the reality
Mm-hmm.
of this. He just doesn't get it. I mean, he probably has never encountered it, you know, face to face before, but he just does not get it. He's about to walk into the hospital, you know.
Oh my God, Jess, that yeah, and you can't literally
Yeah.
show them exactly what's happening in the hospital either, right? They just have this
Yeah.
bubble,
Yeah.
and I'm not saying that, but yeah, it's heartening to.
I get it. You know, I understand, and this is where I have been learning to practice a lot more patience and try not to take it personally, and try to look at it from their perspective. It's, you know, it's just that lack of understanding because they don't deal with it on a day to day. But I think it just floored me that it's I mean, not to say it's acceptable in any other environment, but it's, you're coming into a hospital where there's vulnerable people coming in for
Yeah,
chemotherapy
yeah,
treatments and, you know, things like
exactly.
that. And it just hit me that there's such a disconnect. And when we were trying to, you know, people from our hospital were trying to say you can't come in, again we were seen as the
Yeah.
villains. You know, it was just very,
Oh,
it was very upsetting. But again, from that, moving forward from that point of view, I did have conversations with other people, and realized that, you know, it's what you encounter, what you see, that, you know, contributes to your emotions and your thought process. And yeah, the dialogue needs to
mm.
happen more and more,
I
I
wanted to
think.
know if the hospital or people in general seeked counseling in the hospital. Are healthcare workers going through counseling?
Yeah, so our hospital has really done so many wonderful things for that. They had counselors available for those who sought it out. They had Zoom meetings where people could come in just from any part, you know, any side of the employment of the hospital to kind of vent their feelings and talk about it as a group. Um, there were, I think they even provided some discounts on things like the mindfulness apps. Um, they had all sorts of little programs that they sent out daily emails about, where you could kind of seek that emotional support that you may need, you know, to kind of.
Yeah, I'm about to interview a amazing psychologist from our community, and she sent me an article about how overworked the psychologists and psychiatrists are right now. And it's the same
Mm-hmm.
situation. It was the same situation, or it still is, with the health worker. I think it has gone down, I'm sure, with all the shutdown and shelter in place directive, I'm sure it's not as, is it as intense as it was when it all started? Take us through the 1 year of your own personal observation of the intensity of COVID at the hospital.
I would share that a lot more of these COVID units that we had to put in different parts of the hospital to address the incoming sort of group during the surge, that's starting to shut down because, you know, some of them are starting to shut down or reduce the beds because there's less COVID, like severe COVID patients that need hospitalization at this point. It's come down, I would definitely say, at least where I work. I know the DCU center too. I think parts of it is not quite as crowded as it was in the beginning. So I do feel hopeful. I think things are starting to improve. You know, the numbers may be high in the community, but the requirements are for hospitalization. It seems like to me that it's starting to sort of come down, which makes me feel a lot better.
Let's focus our energy on the end of the tunnel that we can see now, about the vaccines. First things first, have you gotten the dose?
Yes, I've gotten both doses. I got Moderna. I think it's almost been about a month or a little more than that we've been able to get it. I think we completed it maybe a week before. Both my husband and I work in medicine, so I think we completed it maybe like 2 weeks before Valentine's Day. So it's been more than, about that time. And thankfully my parents have also gotten it. So yes, absolutely. I feel much more reassured, much more like there's a light at the end of the tunnel, much more hopeful. Yeah, now that I've received and see other people receiving the vaccine.
I think mask has become such an integral part. Are you still wearing mask?
Oh, yeah. There's no real data at this point about transmission. So that's huge. Asymptomatic transmission, there's not enough data. They're looking into it, but there's just not enough conclusive data that even if you're not affected and, the vaccines ensure you don't develop some of those adverse symptoms. And in a sense, you personally do not become infected with the vaccine, but there's not enough data about transmission to other people, So yeah, masks are really, really important until everyone, is vaccinated.
Jess, did you lose patience with explaining it to your relatives or people at your workplace who were not willing to take the vaccine? And were you apprehensive of taking the vaccine?
No, I was not, because I knew that it went through all the phases of clinical trial, almost all. I stay up to the third phase. They still have to go through the fourth phase. So I knew that there wasn't any compromise in the amount of clinical data that was collected. It's just that we don't know the long-term effects, and it's not that it could be compared to something that was already out there. It's just a brand new. So that's mainly the reason it hasn't received that official approval, even though it does have emergency authorization for use by the FDA. So that's mainly so I knew that. I kind of have that sort of scientific background that I was able to and from talking to some of my colleagues and things like that. So I knew that. The only things were that, we didn't really know what the immediate kind of side effects would be, that kind of thing. But honestly, I saw so many people with COVID in the hospital, in the ICUs, intubated. And I was just doing a little pros and cons list, and I was like, I don't want to be that. I don't want to. The main issue is I don't want to be transmitting anything. I want to, So for me personally, I wasn't apprehensive, but I know there were even nurses in our hospital that were really concerned about getting it and didn't think they were going to do it. I had some family members too that were really apprehensive about it as well. I tried really hard not to take it personally when people said, because you hear a lot of the politics and reasonings that way about why people don't want to take it. And, I had to be very patient in some conversations when I tried to explain, the mechanism, the fact that it did get, this emergency approval, the fact that it was just basically just sped up with just developing the amount of vaccines and things like that. So, I just had to, practice a lot of patience and try to understand from their perspective, which, is important because not everybody, and that's part of the reason I wanted to have this conversation, because not everybody is aware of
Yes.
sort of the process. And
Yeah, this is
why
very
it's
important. It's important to
So,
talk about it. It's important to also, try to answer those questions people have in their minds about the vaccine. It's. Thank you so much for doing it again. I'm like, I'm so thankful that you're on the show. I was wondering. So, were there times when you actually lost the patience to with people explaining?
Okay.
I want to know that.
Oh my gosh, yes, yes. I've had to have my husband then go back and be like, she really means this. Excuse her like reaction to this. I'm human. I'm gonna,
Yeah.
and especially when I see some of these really terrible outcomes that come from just having COVID. Yeah, there was definitely times where I was really impatient, especially when people, some of these things that are coming in the news, some people were saying, oh yeah, the government is injecting this way to track you, and some of those things
Oh
that
my God. Yeah.
you hear about, and
Yes.
I just want to be like, there's amazing scientists out there that are looking at this. It's science. Come on.
Yeah. True that. Jess, what would you tell people today after the vaccine? You've taken the vaccine, you've gone through the side effects, and what would you like to say out loud to people now who haven't gotten the vaccines?
Do your research. There is a lot of good. Do your research okay. So I would say it is important to do your research, speak with medical professionals if you can, if you have questions. Don't rely on social media and sometimes these sort of like media outlets that can be really alarmists. You want to make sure that you're getting the right information, because it is your choice. Absolutely, I respect that, and I think most people should. But yeah, do your research. There's tons of information on the CDC website, the FDA website. There's tons of journal articles out there. I don't expect everybody to read them because they can be pretty complex, but there's tons of information for you to make the decision that you need to. And try to keep in mind, it's not just for yourself. You're trying in ways to ensure, we still don't have a lot of data on it, but there's been some data that just shows that we can prevent this from affecting people who are vulnerable. And so try to keep that in mind. And if you want things to come back and function appropriately, and you want to be able to go and enjoy some of those aspects of life that you maybe have been restricted from doing, these are steps in that direction. To be able to go out and,
I totally agree on that. Oh my goodness. We need to get back to at least some sort of a normal, old normal.
Yeah, it might be a new normal, but it's going to be, I think better than what we've experienced so far.
To catch up more about vaccine, go to our YouTube channel where we have published a vaccine story with Jessin in detail. All right, Jessin, now I'm going to take you really back to the place where you were born and brought up. Tell us about your childhood and growing up in Massachusetts.
So I was born in Saudi Arabia, but then I lived with my grandparents in Kerala up until I was maybe 1 to 2 years old. So I still have, like, my first formative, memories are India, from Kerala. My experience is my grandparents, living on the farm and living in sort of like that village setting, it's gorgeous. Oh my gosh, it's a beautiful state. Yeah. And I got to have some really great memories with my grandparents, and and I spoke Malayalam. I didn't know like any English.
Uh-huh.
And then
Kids that
yeah,
young
then
pick up on language so quick. Yeah.
yeah, and then and then my parents, the reason I lived with my grandparents at the time is because my parents were coming to they're trying to make sort of start up a life in the US so that it'd be sort of easier and safer for me to be brought over once they've sort of settled things a bit,
Right.
because they weren't quite sure where they were going to live. You know, my mom came here after passing the nursing exam because they needed an increase in nurses in the US at the time. So she just got, brought over. She was waiting on my father to get accepted to come over. And they had no place to live. Like, they just lived in one of the dorms in the hospital. And so they were like trying to make a life to,
So when was this?
that would
What
be
year are you talking
accommodated.
about?
I would say like 1987, 88, or 1986 to 87. I was born around that time. I was born in 1986, so they were still
And at what age
working
did
out
you arrive here?
Probably 3, 4,
3, 4.
3, something like that. Hard for me to remember. I know I'm so bad at dates.
I'm bad at dates too. But yeah.
But yeah, that was, and I remember coming through the airport in Massachusetts, Logan, and seeing just a city for the first time, buildings, and at that time there were like these sliding doors, and I was like, what is this? An escalator, things like that. I was just so amazed because it was so different from what life was like back home. And I was brought up in a very small town, predominantly white, not many Indian people or people of color at all. It was in Millis, a small town in near Milford, that kind of area. It's off of 109. 109 runs right through it. Very small place.
Okay, so you went to school in Millis.
I went up to middle school, and then I went to a private school. My parents took me from the public school to private school.
Okay. Wow. That's quite some journey, huh?
Yeah.
So what got you into nursing? Was it the family because of your mom or being there, or was it something that...
So I actually started with studying neuroscience, and I thought I was going to go the research route. I was really interested in that aspect of it. But my mom, by that point, became a nurse practitioner. And, she's my hero. The things that she was able to accomplish, working full-time, taking care of me, getting her master's. Now she has her doctorate, and working and what she was doing. So I wanted to see firsthand what she was doing, what her responsibilities were. And because the nurse practitioner, I think back then, was pretty new field. So I interned. She connected me with one of her colleagues. So I sort of shadowed some of the team. It was like a pulmonary team at Children's Hospital. And it was a team full of different kinds. There's doctors, there was nurse practitioners, there was respiratory therapists, and they rounded together. They went to the patient's bedside together. And I really liked how the nurse practitioners on the team, you could see how connected they were to the patient.
Just since you grew up in a small suburb, did you face any sort of a racism, things that were told to you, that you were different? Or I just want to know, because you arrived here when you were really little.
Dream as other women of color, like the African American, systemic racism that's there. I experienced some things where I felt very different, and it was expressed to me that I was very different than other people in our community, because it was predominantly white Catholic communities. I went to a private school that was the same. There's maybe like 3 women of color in my class group when I was in high school, or in middle school to high school. So definitely, I remember very, very much, even at Millis too, that it wasn't quite as diverse. I mean, things have changed now for sure, but when I was growing up, it wasn't quite near as diverse as it was. So I didn't even notice my skin color, to be honest, until I came to the US. Like when I grew up, and I spent many years in Kerala. And I remember going to school for the first time in elementary school, and one of the other kids, just lack of knowledge, was like pointed at my skin and was like, "Your skin looks different." And the words she used, and she was young, she didn't know any better. She was like, "Your skin looks dirtier than my skin." And I was like, and it never occurred to me. And at that point, it would hit me that I was like, "Wow, I guess I'm brown and they're white." And it was just, I remember that to this day. And I remember being like, is it because I'm dirty? Like, is there something wrong with my skin? And I would wash my hands, and, I would hear all these commercials of Fair and Lovely, I'm sure you've heard of, in the Indian market, where they're promoting fairness. And so suddenly that was like a very, and that's pretty deep rooted, unfortunately, in our community. I hope that's changing. But, there's this sort of perception out there: the fairer you are, the more beautiful you are, and in some ways the more successful you could be, and things like that. So then I growing up, I definitely felt like, wow, I'm darker than most people. Like, oh, that's and I would try to find ways to sort of not be, but there's no way you cannot be. You can't change your skin color. There's nothing you can do about that. And again, it wasn't that kid's fault. She just never encountered at that point, just never encountered anyone that was not white.
Which is why
so like little things like
diversity is so important from early on. To know.
It's important to encourage, certainly, as parents. I think about that all the time, and vice versa. There are a lot of communities in different parts of the world that's, the Indian groups sort of like gravitate towards each other, and they don't interact that much with, people of different backgrounds either, Chinese or, African American, and things like that. So, and so definitely, and some aspects of school, things like that. I remember, being made fun of here and there about, oh, you're of this Indian culture. Are you like Apu from Simpsons? Like different ways that, that we still kind of encounter it here and there. People just, unfortunately, are somewhat ignorant about things and just haven't had exposure. So I've learned over time to not take it personally, to be honest, and I have learned to deal with it, feel more confident in my skin, feel more, and it really, thankfully, again, I think we're not limited in what we can do and how to inform. I've learned to figure out what kind of language I can bring into conversations to help people become more aware, if they aren't already, of how to deal with people of color. And I'm still learning myself, honestly. I think I was so focused on myself, I didn't really learn as much about like the systemic racism that African Americans have felt. My husband is very, very passionate about those kinds of things, and he learns about everything history wise too. He's read into a lot of things. He kind of helps me understand all that too. So there's still a lot for me to learn, but my personal experience, it's been very interesting. And I think my life here, because if I were to stay in India, I don't know that I would have really ever experienced this, or at the same time learned from it. And I think that makes us.
And I'm just asking because how do you feel about living in Wayland? Have you made friends?
Honestly, I haven't really been able to go out into the community and make friends. And I think part of that is because we've just been so busy with COVID. So I can't honestly answer if the Wayland community, were that experience here.
We are definitely meeting once all of this is over. Thank you so much for sharing this with us.
Thank you for having me. I appreciate the time and effort that you've been taking, and I appreciate this podcast, and I'm excited to see where things go from here. I've it's going to be great, I think.
Thank you so much. Yes. Thank you so much for listening to this wonderful conversation with Jessin. And now it's time to talk about our mid-season break. Yes, we are taking a mid-season break and we will be back in fall with the rest of the stories. If you or someone you know has a locally owned business and would like to sponsor our stories, please email us at waylandpodcast@gmail.com and help us raise money for our local nonprofits. Also, don't forget to subscribe, rate, and review us because that helps. This is Yamini, your host, and you were listening to Women of Wayland, the podcast.